Hello everyone, welcome back to our NABH training series. Today we are going to discuss PSQ.4, which is one of the most practical and implementation-focused standards in NABH. This standard is all about using quality improvement tools and conducting quality improvement projects. Now understand this very carefully. NABH does not want hospitals to only identify problems. NABH wants hospitals to systematically solve problems. And that is exactly what PSQ.4 is about. What is a quality improvement project? Let me simplify this concept. A quality improvement project, also called a QIP, is a structured activity conducted to improve a process, reduce risk, enhance patient care, or improve operational efficiency. It is not random work. A proper QIP must have a defined problem, baseline measurement, action plan, timeline, final evaluation. Minimum 2 QIP every year. Now let us come to the first core requirement. NABH requires every hospital to conduct at least 2 quality improvement projects every year. Very important point. These projects must be time-bound, measurable, documented, outcome-oriented. This means you cannot simply say, "We improved hand hygiene." You must prove it with data. Suppose your hospital identifies high patient waiting time in OPD. Then your QIP may look like this. Problem: high OPD waiting time. Baseline: average waiting time, 90 minutes. Intervention: additional registration counter, queue management system. Outcome: waiting time reduced to 35 minutes. This is a proper QIP because problem identified, baseline measured, action taken, improvement documented. Improvement in patient care or operations. Now NABH also expects QIP to improve both patient care delivery or hospital operations. 6 domains of healthcare quality. NABH mentions 6 important domains which your project should address. 1. Patient safety, example, reducing medication errors. 2. Cost effectiveness, example, reducing wastage of consumables. 3. Patient-centered care, example, improving patient communication. 4. Timeliness, example, reducing laboratory turnaround time. 5. Efficiency, example, improving discharge process. 6. Equity, example, equal treatment irrespective of financial status. A mature hospital selects projects that create real impact on patient outcomes and operational efficiency. Use of quality improvement tools. Now this is the heart of PSQ.4, appropriate use of quality improvement tools. Important concept. NABH does not want random improvement activities. They expect scientific problem-solving methods. Analytical tools. Let us first discuss analytical tools. Root cause analysis, RCA. This is used after incidents or errors. Example, suppose wrong medication was administered. Instead of blaming staff, RCA asks, why did this happen? Possible causes may include similar packaging, verbal orders, inadequate verification. Pareto Analysis. This follows the 80-20 principle. Example, suppose 80% complaints come from only 2 departments. Then improvement efforts should focus there. Run chart, used to monitor trends over time. Example, infection rates over 12 months. Flow chart, shows process steps visually. Example, patient discharge process mapping. Histogram, used to understand frequency distribution. Example, distribution of waiting times. Statistical tools. Now let's discuss statistical tools. Control chart, used to identify whether process variation is normal or abnormal. Sampling, important when large data sets are involved. ANOVA, used for comparing multiple groups statistically. 6 Sigma, used to reduce defects and variation. You do not need complicated statistics for every project, but you must select the appropriate tool. Managerial tools. Now let us discuss managerial tools. PDSA Cycle, most common, plan, do, study, act. Lean management, used to reduce waste and improve efficiency. Force field analysis, used to identify supporting and resisting forces during change. Affinity diagram, groups similar ideas together. Tree diagram, breaks larger goals into smaller actionable steps. The tool should match the problem. Wrong tool selection leads to weak QIP. Patient-reported outcome measures, PROM. Now coming to a very modern and advanced concept in NABH, PROM, patient-reported outcome measures. What are PROM? These are outcomes directly reported by patients regarding their health status and quality of life. Simple explanation. This means we ask patients, Are symptoms improving? Can they function better? Has quality of life improved? Areas covered. PROM may include physical health, mental health, social well-being, functional improvement. Examples: pain score after surgery, functional status after orthopedic treatment, breathing comfort after pulmonary treatment. Why important? Because success is not only what doctors think. Patient perception also matters. Use of PROM. NABH expects hospitals to use PROM for better communication, shared decision-making, improved patient satisfaction. Common NC or closure. NC1, no QIP conducted. Closure, conduct minimum 2 QIP annually, document baseline and outcome. NC2, QIP without measurable data. Closure, define indicators, compare before-after results. NC3, no timeline in QIP. Closure, mention start date, end date, milestones. NC4, no use of quality tools. Closure, use RCA, Pareto, PDSA, etc. Document tool usage clearly. NC5, QIP not linked to patient care or efficiency. Closure, select projects impacting quality, cost, safety, or operations. NC6, improvement not evaluated. Closure, measure post-intervention outcome, verify sustainability. NC7, staff unaware of QIP methodology. Closure, conduct QIP training sessions, develop departmental champions. NC8, PROM mechanism absent. Closure, develop patient outcome feedback forms, include quality of life assessment. Final summary: always remember, quality improvement is not about paperwork. It is about solving problems scientifically. And successful hospitals do three things well: measure problems, analyze causes, sustain improvements. In the next video of this NABH training series, we will discuss PSQ.4 Clinical Audit System. If you found this session useful, like the video, share with your colleagues, subscribe for more NABH training sessions. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.